there's obviously a bunch of different peptides out there that helps you lose weight. Some have been around longer than others, but probably the newest and most cutting edge in the market right now is a peptide called Tirzepatide. Tirzepatide is what we call a GLP-1 agonist, a glucagon-like peptide. It's a fancy word, but really all it means is it suppresses your appetite, but at the same time it slows down your entire digestive system. It's pretty incredible. A lot of guys have gained the weight, they've lost it, which is good, but then they've gained it right back. A lot of people don't know why that happens, but it's actually quite simple. You know, when you become overweight, you actually create new fat cells. However, when you lose the weight, you still have those fat cells. So it's not just about losing the weight, we have to address the actual problem, which is the fat cells. That's why we like to pair Tirzepatide or semaglutide with AOD. AOD is anti-obesity drug. Essentially, it's a fragment of growth hormone, but it's the fragment responsible for fat loss. It's the only thing that can actually kill the fat cells besides actual HGH. So while we like to see you lose the weight with Tirzepatide, I'd love to see you keep it off long term, and that's really why we put the AOD in there with this. Semaglutide is basically an older version of Tirzepatide. Semaglutide came about around 2021, worked really well. What we saw was that patients that took this for about a year on average would lose about 15% of their body weight. That's pretty incredible to begin with. But now a newer peptide came out called Tirzepatide, which is the cutting edge one. That one, people are losing about 20% of their total body weight in a year. That's incredible. I mean, there's nothing in the market that can even hold a candle to that, besides bariatric surgery. Now with that surgery, you can lose about 25%, but for me, I'd rather do an injection once a week than have to get a surgery to lose it. Yeah, so that's a good question. It's going to be patient specific as well as dose dependent too. So a lot of guys on average will see results in about 3 or 4 weeks. And when I say results, I mean they'll see the appetite being suppressed. The weight's not immediate. That takes about 4 to 5 weeks to start happening. As far as the digestive system slowing, that's an immediate thing. But typically you're not going to start seeing the weight come off for about 3 to 4 weeks. Some guys it might take up to 6, but usually by the time you finish this first round of Tirzepatide, you're going to see the weight come off. When you're not eating as much, you want to make sure you're doing intermittent fasting in conjunction with this. And the reason why I say that is there's a million diets out there, and I hate using that word, but intermittent fasting is the only diet that can actually improve your growth hormone levels. It's very important for a couple different reasons. Number one, we don't want you to lose weight. We want you to lose fat. We want to make sure you keep the muscle on, and that's why growth hormone is so important. It's the only thing naturally that can actually produce more growth hormone. So we recommend starting off at a 16-hour fast, basically 16 hours without any food, without drinking anything. That's going to ensure that you keep as much muscle as possible. Obviously, incorporating protein in your diet is going to be a big part of this too, but you definitely want to do intermittent fasting and get that growth hormone level up with this. Again, it's all going to depend on how much protein you're taking in, what your weight or your workout routine is like, and also if you are taking any type of peptides in conjunction with this to help raise growth hormone. Growth hormone is really what it's going to do is cause nitrogen retention in your muscle. It's going to be able to keep the muscle on your frame, but it also helps you recover a lot faster and build more muscle. Most people don't realize that growth hormone actually causes your muscle cells to divide and multiply. It's pretty amazing stuff. So if you have more muscle cells, you can actually build muscle even in a calorie deficit with Tirzepatide. Both semaglutide and Tirzepatide were actually based off of a medication called Ozempic. If you're diabetic, you probably are familiar with this medication, which is why it also controls your blood sugar. So there are patients that come in here that are on Ozempic that maybe don't manage their diabetes that well. We'll switch them off of Ozempic, put them on Tirzepatide or semaglutide, and you'd be surprised in 6 months, they might actually be off of all blood sugar medications. Again, this is something you want to consult your doctor with first before stopping into their medications. But yes, we see people come off of Ozempic all the time, switch to Tirzepatide, and then in 6 months, they're off of blood sugar control. It's pretty amazing. So how long you're going to be on it for, it really depends on your starting point. The more overweight you are, probably you're going to have to be on it a little bit longer than other people. But again, it's going to come down to your workout, your diet. All those things are in consideration too. I have not seen a patient need to be on it longer than 6 months. I'm not saying you can't be, but I just don't see it typically happen here. Yeah, of course. So not everybody's gonna be a candidate for this. Most people are, but it's really gonna come down to what your lab work says. So there are 2 things that you have to qualify for. Number 1, your blood sugar has to be above 5.4. Your A1C needs to be a 5.5 or higher. The other thing is you have to make sure your kidney is functioning correctly. More specifically, your EGFR, how efficiently it's filtering the red blood cells. That's gonna be the biggest thing holding you back from this medication or allowing you to have this medication. Yeah, so the first step's gonna come in, have a consultation, get some labs drawn, and then see Dr. Khokhar. Once he does your physical and the labs come back, if your lab work looks like it needs to be approved for this medication, then we can talk about how I could proceed with that. Yeah, of course, we're a one-stop shop. You know, we hold you accountable, but also, you know, once you start the medication, we will be reaching out to you, you know, on week 3, 5, 8, 10. You just want to make sure everything is going okay, that you're dialed in specifically, but more importantly, that you're not having side effects too. So when you see all these celebrities losing weight really fast, I'm sure there's some growth hormone involved in that, but a lot of them are taking Tirzepatide that I know about. You probably know about a few of them as well. I mean, this is revolutionary. It's the most cutting edge thing on the market right now, but this is going to become more popular as time goes on. So there's not a lot of advertisements for this right now because it's not really specifically meant for a weight loss protocol for a primary care physician. They're mostly using this for blood sugar control. You may see commercials on TV for it, but it's not going to be the peptide form, which is Tirzepatide. You're probably going to see it called Mounjaro, which is the prescription name for this. That is the diabetic version of this. Do you want to see if you qualify for this new revolutionary peptide? Come on into Alpha Male Clinic today, see one of us 3 coaches, get some lab work done, and let's see if we can help you lose some of that weight.